And charges are still pending.
Tonight, a new study linking COVID-19 stimulus checks to a record increase in opioid deaths. This is the first study of its kind to find this correlation. Dayton 24/7 Now's Allison Walker is live here in studio tonight with the findings. Allison.
Megan, the Attorney General tells me the director for the future of forensic science noticed the trend, so they dug into it. It took researchers 10 months to complete this study, yet Families of Addicts tells me the report merely proves what we were already experiencing on the ground.
Somebody who helped with some FOA stuff 2 days after getting a stimulus check did overdose and die. Newly recovered people, it's the temptation.
The study analyzed data from the Ohio Department of Health and found opioid-related overdoses in the second quarter of 2020 coincided with the delivery of stimulus checks. That same quarter marked the highest opioid overdoses since 2010. The study details the payments alongside other pandemic stressors created a perfect storm for those grappling with addiction. Now Anita Kitchen with Families of Addicts is ringing the alarm.
If you look at the numbers back in 20 and 21 when we received stimulus checks, those months that the checks were released, those months the numbers are a lot higher as far as overdose deaths.
What action do you hope to see come out of these findings?
Nobody knew that this correlation would exist. We know now. So as we think about emergency responses, it's important for us to ask how we design these programs. For example, what if it was spread out over time?
Ohio Attorney General Dave Yost explains stimulus payments were a national experiment. As some lawmakers push for a fourth round, both Yost and Kitchen hope they keep unintended consequences in mind.
I'm more interested in seeing policymakers acknowledge the fact of the link and talk about how we should design these programs to try to protect these vulnerable folks.
20 was 323 and 21 was 337. And so far this year, we've had 30 overdoses. Yeah. So that would match what, in the 300s. It's a crisis in the public health sense.
The Montgomery County coroner says the rates are double what he's seen most of his career. 90% of those deaths are fentanyl related. As an influx of fentanyl and meth crosses the border, all parties involved say the path forward means bipartisan political will.
I hope we could agree on this. We should try to avoid causing more opiate deaths by actions that the government takes.
Families of Addicts is advocating for any additional government funding to go towards grassroots organizations, not individuals. Meanwhile, Attorney General Yost says it's important to note that this study is peer-reviewed and was accepted for publication by an international journal. Back to you.
Allison, thanks so much. 85% of the Attorney General's $808 million settlement with the largest opioid distributors is going to be going toward local recovery programs. If you want to read more, you can head to our website, DAYTON247now.com right now, and click on this story.